On today's episode, we're going to talk about females' sexual problems and dysfunction. I've already posted men sexual dysfunctions. Now we're going to look at women's sexual dysfunctions. And again, sexual dysfunctions has been defined as a state in which sexual behavior or the lack of it causes anxiety, anguish, and frustration. Researchers believe that it may not be possible to identify the precise cause of a particular form of dysfunction. Dysfunctions may have multiple causes. Psychological factors that result in sexual dysfunctions are numerous. Developmental factors include troubled parent-child relationship, negative family attitudes towards sex and sexuality, traumatic childhood, adolescent sexual experiences, conflicts over one's gender identity, pregnancy, venereal disease, and rejection. Those are some psychological facts or developmental factors that can cause a woman to develop sexual dysfunctions. So what is female sexual dysfunction? Many women report that their sex life has lost some of its spark because their body feels unresponsive or they are just not interested in sex. This can happen at any age, but it is most common when hormones are in flux. So when a woman's hormones are in flux, meaning if she just had a baby or she's going through menopause, she could develop sexual dysfunctions. Symptoms include the following. The woman's desire to have sex is low. The woman cannot maintain arousal during sexual activity or cannot become aroused even when she wishes to have sex. So these are the symptoms. And so if you're not aware of why your woman have a low sex drive, it could be, again, the desire is low. Because she cannot maintain an arousal is because it could be any of the factors that I spoke about before. If she just had a baby or she's going through menopause, or developmental factors which include parent-child relationship, negative family attitude towards sex and sexuality. Traumatic childhood can cause this, bad sexual experiences, conflict over one's gender, venereal disease, and being rejected. A woman, if you reject a woman, she could develop sexual dysfunctions. If you didn't know, now you know. So be gentle when you're letting women down, men, please, because that could really kill their sex drive. Causes of a female sexual dysfunctions often are interrelated and can be physical, hormonal, psychological, social. Physical conditions that may contribute to sexual problems include arthritis, urinary tract infection, pelvic surgery, fatigue, headaches, other pain problems, neurological disorders such as multiple sclerosis. Hormonal conditions include lower estrogen level during menopause. We spoke of that before. But this is the thing. During menopause, the fold of the skin covering the genital region, the labia, become thinner during the menopausal transition and expose more of the clitoris, right? This sometimes reduces the sensitivity of the clitoris or causes unpleasant tingling or a prickly sensation. The vaginal lining also thins and becomes less elastic, especially if the woman is not sexually active. The vagina requires more stimulation to relax and lubricate before having intercourse, and this can lead to painful intercourse. So this is for women that are going through menopause. So men, if you're dealing or have a spouse that's going through menopause, just know that this condition also can lead to women having sexual dysfunctions, and it's by nature. It's not something a woman can control or stop once menopause is going down. These are the conditions that she may or may not experience, but again, one or two of these conditions may affect her drive for sex. So the psychological and social causes include untreated anxiety or depression, because anxiety and depression can also cause that, especially if it's long term. The worries of pregnancy and the demands of being a new mother can have similar long-term effects. So these are symptoms and causes why a woman may have sexual dysfunction problems. Now, this is part one. We'll get into part two as far as treatment and therapy. So this is episode 1 of Women's Sexual Problems and Dysfunctions, and we'll subscribe to my podcast so you could keep up and get info. We'll be posting a new episode 2 of treatments for women's sexual problems. That's it.